consumer becoming Google friendly, more health literacy coming into the picture, more awareness coming into the picture, this particular session becomes the most important. And I have the privilege to be with the Dr. N.L. Sridhar. And Dr. N.L. Sridhar, before we start, in one line, if you can tell about yourself so that people will remember you, it would be great.
Thank you very much. First of all, I want to thank 2025 Dental Summit for giving me this opportunity. I'm Dr. N.L. Sridhar. I'm a pediatrician, M.D. Pediatrics. I've done my LLB, and since 6 to 7 years, I'm supporting the medico-legal department of nationwide and also statewide, creating some confidence in the doctors so that there's nothing to fear when you start the practice, nothing to fear when you join your job as a dental surgeon or medical, any specialty. You should have a bold enough to face the things. Once you sit in your chair, you should be bold enough to face the things. So that things will come into the next talk. Please.
So my question to you, Dr. Sridhar, will be like the study says that there are nearly 40% of dental negligence cases in India with some liability. So with your dual experience in law and medicine, why are dentists becoming more vulnerable today?
Yes, sir. It's a very excellent question, sir. The basic thing is, since 10 years, you know very well, the Consumer Protection Act came into very existence since 2098 and 2007. Now in 2019 also, they framed some more rules. So it is becoming day by day a patient sympathetic and patient friendly more than a doctor things. So since the incidence of cases around in the question itself is saying 40% is a huge number. So the first important is patient awareness, sir. So awareness is increasing from the patient side, and consumerism. So the Consumer Protection Act, which is in 2019, is revealing these things. And second important thing is digital visibility coming into act as a legal visibility. So if you see some dentals, you get a 100% smile, you promise 100% painless procedure, like that. These are the digital visibility from your clinics, from your hospitals. That will become a legal visibility. That is the second important point. Third is documentation gap. We'll have a few case scenarios also later, but the documentation gap, once there is a beautiful word, implied consent. Implied consent means if your patient comes into your clinic, it says that he came for the opinion of, there is no need to take a consent. But when you do a procedure, any aesthetic or normal procedure also, you have to take a consent. That is the importance of the documentation. And documentation gap is huge in because of the more cases you see. So the time given to a patient, concerned patient, will be very limited. So you should have a mindset of consent first mindset. That should be the thing, sir. And third important thing is commercialism and also corporate chains. These are creating again a gap between a patient and doctor. So these are all the things where we have to think in the way. That's why these are increasing day by day. And a judicial shift from the doctor's defense to patient's rights. Every patient is having a rights. Around 12 rights are there. Doctors are having rights. Doctors having a friendly sections in the cases, legality. You are having a rights and legality also. So these are all the judicial shift from doctor's defense to patient right has increased, and that's the reason why the number of cases are increasing, sir.
So it's quite insightful. In your practices, are these cases really genuine negligence, or is it because of dissatisfaction due to poor communication? What have you come across?
Yes, sir. The next, really, it is an excellent question, sir. The first thing is due to technical fault and negligence is only few, 10 to 15%. But the communication gap, what you maintain with a patient is much 60 to 70%. Whereas the dissatisfaction, your assurance, the patient may be gone for aesthetic procedure or some other procedure where patient may be having a long pain for 6 months or 5 months or 6 months and he would have an infection. This dissatisfaction is only few, sir, 10 to 15%. The most important is communication gap. So you should take a consent before doing the procedure, and also before giving the anesthesia, you have to clearly explain the procedure and complications and also how much. And dissatisfaction is one more point for increasing the amount. See, if the first assurance package is around, some examples, for 100 rupees. Next, you enhance the price, that may be the dissatisfaction for the patient. So we have to be on war foot for these three things, and technical fault shouldn't be there, and communication gap shouldn't be there, and third, patient should have he shouldn't be dissatisfied with the procedure what you have done. These are the things.
So there was recently a case in Andhra Pradesh wherein a patient claimed the multiple RCTs were done unnecessarily. Such
Yes.
kind of case can happen with any dental doctor. In that scenario, how should a dentist should defend with such allegation?
Yes, 6 years back there was a case, as you said, sir, in Andhra Pradesh. The doctor is a senior doctor. He had done so many root canal treatments. So the media and the case was raised on them, and the government had given a case on them. And he had really is a somewhat techie personality in the dental. So I can say that you should maintain the proper records. That will keep you away from this medico-legal things, and you shouldn't give a false promises for them. And the root canal treatment should be, it's not a 100% painless, it is a painful one. So you give assurance that a decayed tooth needs root canal treatment, not it's 100% painless, you don't mention that. So some brochures and some flyers we used to see 100% painless like that. It shouldn't be like that. That is the reason why it should be, when I set an example, so the root canal treatment for the decayed tooth, but not 100% painless. That shouldn't be there, sir. These are the things where recording of the documentation, consent form, and always I will be repeating these things only in all the questions and all the case scenarios, because documentation is the only one in all the medical or dental or anywhere where you will be caught. If you have a good documentation, and your staff also, sir, the staff and also the system liability should be there. The staff should be properly trained. So these are all the things where our consent, documentation and communication and digitalizations of the e-prescription, these are all will prevent the definitely the allegation on the doctor.
So can you share any weird experience in your practice which you have come across, and how did the doctor went about defending it?
Yes.
It could be
sir,
medical
both
one
the
also.
side. Both the side. He was penalized, few cases penalized, few cases he came out with good colors. So one case is a typical dengue case came to a hospital. I am telling about the pediatrics one. And a dengue case came to a pediatric hospital around child is 1.5 years. Counts are 60,000. Child had breathlessness. So child brought around 9 o'clock. The doctor had treated, but he had written only the diagnosed as dengue fever and IV fluids. No other documentation, no other clinical scenarios, because he is busy in practice. So at 10:30, child was still breathlessness increased and thought that to shift to the nearest hospital. This is a level 1 hospital where it doesn't have any ambulance. So they called a auto and sent the patient to the nearest hospital, fever hospital. So fever, when the patient gone there, they said that this case will be not admitted in fever hospital, go to the Nilofer hospital. By the time the case reached the Nilofer hospital, the child was dead. So the doctor had kept on oxygen, everything in the auto itself and sent. But really the case they filed on the doctor saying that the doctor has not treated and not responded well. So it gone to police case and later it case into the court where the thing is he has done the treatment, but documentation is only the diagnosis is there, no investigation report are written, and no treatment plan was written, not even oxygen also. So the patient shifting also, they has not taken the consent. These are the things, areas where you have to keep in mind, and he was penalized for the things. So, and some other cases where few cases, for example, in one female Fatima in 2018, your dental case, sir, she gone against the doctor, and again this doctor was in extraction of tooth. So while doing the extraction of tooth, some gum injury was there, and she went to the court, and doctor was penalized for 50,000. So that is the one of this dental case. But so we have to here, the thing is, when you see the case study, the documentation and consent are not there. So how much important the document, if you see, the standard of care is the word you should remember. You can't be a superman to do all the procedures in 100% way. There shouldn't be a lack of quality of care. That is the only one sentence I can say. If you give a standard of care, quality of care for the patient, he may have the land in complications, the medico-legal will not touch you. So I feel whenever you start practice and whenever you see the procedure, take the consent, document, and do the procedure. If any complication also, the consumer court will definitely support you. That is the
So
thing.
in most of the cases, like the Chandigarh case, Bangalore case, the doctor went about compensating 51,000. If I need to hire you as my lawyer, how much fees I should pay you?
That is depends upon whatever. See, I take a consultation of 500. Some other pediatrician will take 1,000. Some other in the same way, the legalities. Some you would have heard the government will take the lawyer who for 1 hour he charges 10 lakhs, 25 lakhs. See, there is no
That was on
limit.
a lighter note,
But
sir.
in lighter way, what I can say is it will be costing around maybe 40,000 to 1 lakh, not more than that.
So on an average, these folks lost lakh rupee. So now question comes to you is that does the digital documentation like digital records, e-signature, WhatsApp chat holds a legal validity?
Yes, sir. Digital signatures has the validity, and e-signatures, what you take, digital records are having 100% validity, since this is the Information Technology Act, which is taken in 2000 in India, which had given digital records are valid. And second point is e-signatures. Whenever you do a e-signature, you feel that e-signature can be given for my PRO and he can sign. It will again burden for the doctor, but e-signature is valid. But coming to the WhatsApp, sir, you can give the appointments and you can give the information for the patients, but not suggestions, because it is valid in some cases, sir. But I say I prevent WhatsApp messages. If you are really close to them, you just mention the pain reliever and tell them to come to the clinic. I feel WhatsApp should be only the appointments and some study material you can give them. So these are the two things.
Now, the previous session, everyone claims to be the #1 dental center. Okay, so advertising and misinterpretation. What are the legal limits of online marketing? For instance, before, after photos, testimonials, and the claims of painless dentistry.
So this is very huge discussion, sir, basically, and excellent question. See, there shouldn't be advertisement and there shouldn't be misrepresentation. See, whenever if you give a photo, before and after, as a layman, if I see that, I feel that I can become like that. So I will go to that same dental surgeon, I will spend some money, and I may not get the same result. So you shouldn't give before photos, after photos. You should take before photos. That shouldn't be advertised. I feel you should, for advertisement, you can go for your name, your degree, your qualification, your technical support, and your eligibility, what you can do, any procedures, what all the procedures you can do. But you can't go for before photos and after photos and wrong representations like 100% smile, or as earlier said, 100% painless. You have to prevent. You shouldn't go for that advertisement. You go for quality, your own expertise things you can exhibit in the banners or any LED boards.
Yeah. So what you mean is that it shouldn't be advertised, okay, but you can have a published paper or on website, you can keep it. Okay, so it was a pretty, it was like a very good interaction. It was a rapid fire question kind of thing. So let's end up this session with what are the 3 must-haves for a dental practitioner with respect to safeguard his or her interest, practice interest.
Yeah.
3 must-haves.
3 must-have, that is consent and documentation system. That is most important, first one. And second one is professional indemnity and clinical insurance, clinic insurance. Because whenever some harm is done for your hospital or clinic, that should be covered under insurance. And coming to the professional indemnity, if something you, for example, there are so many schemes in the insurances, professional indemnity. If something happens to you personally, if you attach to this professional indemnity, the next day onwards, they will fight for you. There is no need to, you have to submit all the records and everything to them. They will submit, they will fight for you, and you can continue your practice from next minute onwards. So I advise all the dental surgeons to take the professional indemnity and also do the clinical insurance. Third important thing is, before starting practice, you should have all the government framed licenses. One is, first important is your Clinic Establishment Act, your clinic license. Second is you should take the biomedical waste things. You should take all the necessary documents, trade license. These are all the things, and for LED board also you should take the license. So these are all the things which are important before starting the clinic. And as you said, these 3 should be kept in mind. One is framing of government licenses. Second is professional indemnity and clinic insurance. Most important is consent and documentation system. These are most important, sir.
Well, thank you very much, sir. It was indeed interesting. And is there any mistake I have done wherein you can frame me legally?
Nothing, sir. This is an education part, so nothing will happen. These are the 24 ways to be medico-legally safe in 2025, and just list like was. Thank you. Yeah, the first, avoid displaying 24/7 services available. There is a court case in Delhi where 24 availability was there, and he was penalized and he was asked for the explanation. Second point, don't get frightened. Whenever something happens, you should have your legal team and you should have support doctors. Third is maintain proper documentation, follow professionalism and ethics. And fifth is know about your patients and observe their behavior. Really, if you are troublesome, you please avoid them and have proper communication with patients. Do good communication with staff in front of them. Don't scold them in front of the patient. If you have any decision, you take them to your room and scold them. And have positive attitude, self-introspection and self-regulation. Be empathetic to the patient and consult with medico-legal support whenever necessary. Get professional indemnity done. Have crisis management committee at your place if it is a hospital. And give guided prognosis. If you know the disease and complexity of it, please give a guided prognosis and guarantee for care, not for cure. And avoid medical jousting. Don't insult your colleagues. Just say that, okay, we had done the best treatment from this side. Whatever the things I am planning, I will do the best things for the patient. Don't insult your colleagues in front of the patient. That is medical jousting. Avoid cross-cutting and cross-speciality. And beware of Google doctors. They will come in so much huge materials before they consult you. So beware of them. And be a continuous medical education, that is continuous dental education for you. And always encourage and support your colleagues and ask and record and history of allergy is very much important, and follow ethics, morality rules and regulations, and inform police whenever necessary, and prefer group practice, and also remember Harila Jivan Maran. Just comes to lost gain, life, death, fame, defame is in the hands of history. So this is the thing. Next slide. Thank you.